My name is Joshua Austin, and I practice in San Antonio, Texas. With previous scanners we've used in my practice, the scanning part of the process can sometimes be a little cumbersome, especially when we're working on multiple teeth. I'd have to do a scan of each tooth first, and then do a scan of the arch and the opposing, and then 2 bites. So it would make for a significant amount of work in those kind of procedures, especially those procedures like veneers and full mouth reconstructions and things like that. In addition to that, it made for a lot of work after the scan. So I'd be up at my office late doing all of this intricate work on the screen of the scanner so that I could give my laboratory the best results possible, so they could make me the best restorations possible, and then I had to do a lot of work in order to get that. That's all time away from my family, that's all time away from things I'd like to do that I end up doing in front of a scanner or a computer. And that leads to a lot of frustration, and it leads to a lot of after work and a lot of post-processing work that sometimes can be really cumbersome to deal with in the middle of a busy dental practice. And then for my staff, they've always echoed frustrations in the bottleneck that is the number of scanners we have in my practice. As much as I would love to have a scanner in every room of my practice, it's not quite reasonable to do so, so they're always jockeying for who gets the scanner next. When it can be done and out of my room faster, it just keeps that day rolling, and it makes it to where it's a way easier day logistically for the flow of patients through the practice. I've had the iTero Lumina scanner in my practice for a while now, and we've been using it for a lot of restorative dentistry. And what I've noticed is easier scan workflows. It makes it quicker and easier to get done with my scans and get them to the laboratory so that I can move on with the next patient and the next step. The other thing we've noticed is that our restorations fit flawlessly. I've absolutely noticed a step up in my restorations from previous scanners to the iTero Lumina scanner. The first time I submitted a scan from the iTero Lumina scanner for a restoration to my laboratory, I was expecting to hear from my laboratory technician, but it took her about 2 minutes to call me. I went into my private office and I took the call, and she asked me what it was that she was looking at. And I told her, well, that's the new scan from the iTero Lumina scanner. And she said, can you please just send me scans for restorations from that scanner, because that's all I want to work on. With the iTero Lumina scanner, my lab has the ability to see the margins at a level of accuracy that they've never seen before. That gives them the ability to build me a restoration that fits flawlessly. And that tends to be what I see with these types of restorations. And I'm not just talking about crowns either. I'm talking about inlays, onlays, bridges, and veneers. Those types of restorations that need to have this immaculate fit. And with the iTero Lumina scanner, these restorations seem to just fall into place. In a busy general dentist office, there's so much going on at any given time. And the ability for us to get a scan quickly and to have it without a lot of extra steps that we have to go through to be able to produce whatever restoration we're trying to produce just makes the day flow so much easier. It makes everything about the day easier for everyone. Everything flows better when we can capture that data quicker and easier, and that's what the iTero Lumina scanner does. My practice is very busy. We have 3 doctors, we have 4 hygienists. It's always moving. We're on a fast schedule, and we do it quickly. In the past, our issues have always been with capturing data accurately, but doing it in a short period of time so we can move on to the next patient. In today's workflow with the iTero Lumina scanner, I am able to capture a lot of data quickly that is accurate, clean data, whether it be for my laboratory, whether it be for my 3D printed restorations, but it helps us keep up with our day so that we're not falling behind. It makes my life easier, it makes my lab life easier, it makes my team's life easier, and it makes my patient's life easier.